St. Joseph's Healthcare Hamilton had police and paramedics coming together with other community partners to open a new hub aimed at supporting people struggling with mental health issues, addictions, and homelessness in our city. The building is named after a little boy whose tragic death was the catalyst for change in Hamilton. Kelly Botello has the details.
This innocent little boy has been the driving force behind so much good in our city.
Despite the tragedy, there was a lot of progress made from the pain that we suffered.
Zachary Antidormi was just 2.5 years old in 1997 when he was murdered in Hamilton by his neighbor.
On March 27th, 1997, he was out playing with the neighborhood children when my neighbor, who was a woman with a serious mental illness, came out of her back door and stabbed Zachary to death.
Zachary's mother, Dr. Lori Triano Antidormi, had called the police time and time again, but officers didn't do anything, and at the time they had few resources to help in situations involving mental health issues.
She was diagnosed with paranoid schizophrenia, and she believed that the spirit of her son lived within Zachary, and so she had to kill Zachary to release the spirit of her son.
The unbelievable tragedy rocked the city of Hamilton, and soon after Zachary's murder, the first collaboration between Hamilton police and mental health workers began. The programs have grown, and now 40 workers have their own hub on King Street East to better serve the most vulnerable in the city. The building named Zachary's Legacy.
When we're dealing with homelessness, harm reduction, mental illness, etc., it's not about arresting your way out of this. It's about finding a path, and it's about, in fact, the risk intervention and the prevention model.
Hamilton Police Chief Frank Bergen says the need for these services has grown over the years, especially since the pandemic. Just on the policing end, about 5,000 mental health and wellness calls are taken a year. Calls that don't require handcuffs and jail time, but compassion and treatments, the kind of care that can save lives.
The mental health calls that our officers respond to are mainly people in crisis. So when people are in crisis, they could be suicidal.
Of course, Zachary's mother can't help but to think how differently things might have turned out if a place like this would have existed in Hamilton back in 1997.
There would have been help for us, but maybe even more importantly for our neighbor's daughter, who tried also to get help for her mother time and time again, and she too hit barriers.
While the tragedy can't be changed, Zachary's legacy is certainly helping many. Kelly Botello, CHCH News.